or connect with us on social media.
Hey Attack fans, it's Ethan Burrows, number 29 for the Owen Sound Attack. Catch every Owen Sound Attack game live on Rogers TV.
Come home to Hope Valley and see all the faces you love again.
Scandalous. Here you.
Here we all are.
When Calls the Heart Season 7, all month long. And watch all your favorite heartwarming episodes of Seasons 1 to 6, only on Super Channel On Demand.
This is Rogers TV, Grey County.
Hello, and thank you for joining us today. Welcome to this special edition dedicated to the topic of COVID-19 and our community responses to this pandemic. My name is Carol Merton, and I wish to extend a sincere, heartfelt thank you to our Medical Officer of Health, the Public Health Unit staff, our community service providers, and their support agencies, our first responders, our hospitals, retirement homes, and long-term care facilities, along with so many others, for their prompt action and ongoing efforts to keep our community safe. We are all together in this exceptional and ever-changing situation. We are all neighbors doing our best to care and support each other. We will be providing you with current information from our community agencies and elected officials. However, this information may change rapidly. We encourage you to use technology that you may have access online to, and reference publichealthgraybruce.on.ca for current information. Listen to the radio, and of course, tune in to Rogers TV for updated information. Today, I am pleased to welcome as a guest Andy Underwood, who is the Executive Director of Home and Community Support Services, who is here to talk to us about the changes that are happening as we speak in the services that are provided. Andy, thank you so much for being here today. I really appreciate you coming in and talking to us.
You're welcome, Carol. It's a pleasure to be here, and that was a nice introduction.
Thank you.
Certainly, we have entered a new era. And it's we're all learning. I've been working in community healthcare delivery for 30 years, and I've certainly never seen anything like the last 48 to 72 hours.
Yes.
So, as you said, information will change quickly, so refreshing your knowledge base it's a good idea during these times.
Excellent. Now, if you wouldn't mind just talking to us first about the programs, because I know Home and Community Support Services, you provide an amazing variety of services to our community. I'm wondering if you can talk about the service, describe it, and then how it exists now, so that people are current, and what you might expect if in the future, if you have, I know you don't have a crystal ball, but just some ideas on things that may evolve. So I'm going to just pass it over to you, Andy.
Thank you very much. So I'll begin, I will name the service and describe what it is and the current status of it.
Thank you.
So I'll start with our adult day programs. Most people know them as Day Away. We provide those in 6 sites across Grey and Bruce counties. We have drivers who bring people into the programs for the day, so it provides the caregiver at home with some relief. We have nursing staff, recreation staff, and PSWs on site who provide care for the people. They're fed. They have activities and programs and exercises to stimulate their abilities and maintain their health. So currently our adult day programs, Day Away, they are suspended until further notice, until April 5th at this point in time, but that will certainly be reevaluated. Something many of our day away clients participate in also is we have an overnight respite program that functions every weekend. So one weekend it is in Hanover, typically out of the Hanover Hospital. That would be Friday and Saturday night. The next weekend it's in Owen Sound, and it runs Thursday, Friday, Saturday, and Sunday night.
So if you don't mind me asking, so that means individuals actually stay in the hospital?
They would come in Owen Sound, for instance, they would come in at 9:30, quarter after 9 on Friday morning,
Right.
Thursday morning, I'm sorry, and they would stay till 3:30 on Monday afternoon.
So that gives their caregivers a chance for doing
Yes.
things.
And the care coordinators in the community, they used to be, most people know them as CCAC, but now it's Southwest Lynn,
Yes.
or now it's Ontario Health care coordinators. They're the ones that refer these people and prioritize them, so that that's how anyone would enter our day program or our overnight. So the overnight program is reserved for those people with the highest need. Perhaps the individual's got behaviors, or the caregiver, it's critical that they have that break.
Yeah.
Unfortunately, our overnight program is also suspended at the current time.
Sounds like there's a lot of people who will feel the impact from just the day away
Certainly,
program.
and these are people living in a community
Yes.
that do have high needs, whether those are physical, some people have cognitive impairments. They usually live in a home with an elderly caregiver, and that caregiver relief is critical. And also just monitoring the day-to-day health.
Right.
But bringing people into a group setting at this point in time and having them on a vehicle, like a number of people sitting close to each other on a vehicle with the fragility of their health. It's just, and that is province-wide. Adult day programs have been stood down.
Okay. So this creates a huge change for
Yes.
the caregivers.
And just to expand upon that a little
Sure.
bit, when I left my office to come here this afternoon, the staff who run the day program, they're sitting down and they're brainstorming what we can do, because we do not anticipate this is going to have a quick resolution, the social distancing. So we are looking, can we bring in a couple of individuals at a time and support them? Anyway, I guess my point is that our rule book is sort of being rewritten on a daily basis now, our mandate. So we are trying to support our community to the best of our ability, and it is a new day. So we are exploring new avenues to support people, things we've not done or perhaps we weren't even allowed to do at one point in time.
Certainly looking at things in a totally different way to try and provide service if
Yes.
possible. A
Yes.
lot of creative brainstorming going on.
Yeah, and because it's so new, we are still working on some solutions.
Yes.
So that is our day program and our overnight program, our transportation program. We've been working with other partners in the community, so we are still providing transportation to dialysis appointments.
Okay.
Those people are screened every time they go, so we have a regular update on the health of the individuals. If someone was diagnosed with COVID-19, we would not be able to transport them.
Right.
Our staff do not have the PPE, the personal protective equipment, or the training to deal with that situation.
Right.
We are working with our other community partners to ensure other people get to the medical appointments and treatments they need to, and it's a work in progress.
Right.
It's not perfect yet.
So certainly what you're describing are services you're still providing that are essential services for people who are critically ill or
Yes.
needing those services,
Yeah.
like dialysis
And,
patients.
The way the structure was originally put together, no one anticipated a scenario like this.
No.
So, as I said, we are reevaluating on a daily basis what we do and what we can do. So we also have a very large housekeeping program where we have paid housekeepers going into people's homes across Grey and Bruce counties.
Okay.
That is also suspended. I'll skip back now. What we are doing, the nursing staff from our adult day programs, they are calling the Priority 1 and Priority 2 clients on a weekly basis. The Priority 1 clients are currently being called 3 times a week,
Yeah.
or their caregiver in most cases, to see how they're coping. Do they need groceries? How's their health? Are they coping okay?
So if you don't mind, I keep asking
Yeah.
these questions because it's important information. Priority 1, who would fall within a Priority 1?
A Priority 1 would be someone, they may well have a cognitive impairment, they might have some behavioral issues,
Okay.
and their caregiver is at risk of fatigue, overly fatigued,
Okay.
where that situation might degenerate into placement
Yeah.
And obviously, they're not going to be placed in a long-term care facility at this point. So we want to keep these people out of hospital at all costs for a
So-
lot of reasons.
The way you're describing it, the services that you're providing, the people in the community don't have any options at this point.
Yes. and-
Long-term care is not accepting people
Yes.
because they're in lockdown.
And it's not just our organization that's looking for new methods to support people in ways that we have not had to before. I know Ontario Health, I was on a phone conference, and I apologize, but my timeline's kind of blurred since
That-
about
you
last
know, that's
Thursday.
okay.
I've been going to
I
so many
understand.
meetings, and
Yeah.
I've been on so many phone conferences. But I know Ontario Health is, they're looking at very inventive ways to try to make available more home care workers, so PSWs, RPNs,
Yeah.
that can be injected into the system
Right.
to not only maintain what we have, but perhaps meet a surge
Yeah.
because other programs are no longer available.
Exactly.
So,
So
people
you're-
are working at all levels
Right.
at a
Yeah.
rapid pace and a feverish pace
Yeah.
to try to make this happen.
Yeah. So really, the services your agency provides, it's not just to the individual client, it's to the caregivers.
Very much so.
So you're actually encompassing more than just an individual.
Yes. Yeah, we very much look at the family as the people we serve. It's
Yeah.
not just the individual, it's the entire family.
Yeah, yeah.
Um,
So you were mentioning about priority one and that there are calls going out to link.
Yeah, 3 times a week to our Priority 1 day program clients, and twice a week to our Priority 2 day program clients.
Yeah,
Our housekeeping staff are calling their clients on a weekly basis. And same thing, touch base. Do you have food? How is your health? Do you have enough medications? And just their emotional well-being.
Yeah.
So our housekeepers are doing that on an ongoing
Interesting.
basis.
critical connections.
Yes,
That's really what I'm hearing from you.
very much.
Because
and
these people would be isolated.
the need to talk to someone too, we certainly will recognize that. And outside of our organization, in the greater community, people, they're anxious. They're being bombarded by the 24/7 news cycle, and
Yeah.
there's not a lot of good news out there right now.
No.
And there's not a lot of news except COVID-19.
Yes.
So the anxiety level is being ratcheted up. So we're looking at ways to deliver friendly visiting over the phone, and we're making employees available to do that. Versus we will have our volunteers, of course,
Yeah.
those that are able to participate, but we will supplement that with employees. And I've got to say, the outpouring of support from our employees to do something to help, because they're not in program
Excellent.
these days.
Yes.
They really want to support their community, and
So redefining
yes,
the job.
people are being redeployed, and
Yeah.
there's certainly no issue with that. They just want to do something.
You serve a lot of people in Grey Bruce.
About 3,000 annually, yes.
Wow, yeah.
Um,
That's the patients, but then you have I'm not sure if you call them patients.
We call them clients.
But then there's a family that
There's
you
the
serve.
family, and
Yeah.
sometimes the family's removed. We have adult children that are arranging services for the parents, and the children might live in another province, another country.
Yes.
And so technology's enabled a lot of communication, payment method,
Yeah.
et cetera, that was not available previously. So our services extend widely.
Yeah. Any programs we haven't touched on?
Yes. So I've touched on the friendly visiting, and we are ramping up that ability. We will be making more calls, and but something that is, as of noon hour today anyway, our Meals on Wheels program is functioning, and we've taken on some new clients since this has happened, because some of the people that are in the community they have trouble, or they're afraid to go to the grocery store.
Yes.
So we've taken on a few new people
Really?
into our Meals on Wheels.
So tell me a little bit about that, because that is obviously a concern. If people are concerned to go to the grocery store, tell me a little bit more. And are there any specific precautions that people are taking?
Yes, and
around that?
and I've got to say, the support from our volunteers. They're people that have lived in these communities their entire lives,
Yeah.
and there's nothing they wouldn't do for their neighbor or the person down the road.
Yeah.
So we get calls of people offering to help. It's heartwarming.
Yes.
And it reminds you of why you want to live in Grey and Bruce counties.
Yes.
So Meals on Wheels, we've been in communication with everyone who receives the meals, all of our volunteers, and on a daily basis. And we've communicated proper hand hygiene. You know, if someone's sick, and like we recommend people don't enter the home unless some people cannot carry their own meal tray. So in some cases, it is important if there's a concern, we would have a trained staff member deliver that meal.
Yes.
But meals continue to go out. Our meal suppliers have been great. I've got to say, the coming together of the restaurants to provide our meals, our volunteers, our staff. It's people recognize that this is it's a new day, and people, it's you hear about the scams, and the opportunists that are preying upon people's fears and anxiety. And I guess a situation like this brings out the best and the worst in people, but we're seeing a lot of the best.
So the restaurants, there are some obviously that aren't open, and some that are open just for takeout. So you mentioned the restaurants are still able to help you with this program then? Excellent.
And it is, I mean, it's certainly a takeout service.
For sure.
And we experienced something similar in 2003 with SARS. And at that time, a lot of our meals came from more institutional settings like hospitals and long-term care facilities. I mean, they would prepare the meals and put them in trays and set them outside the door. We would pick them up outside the door. So we are being creative, and we are monitoring what, as I said, we are in new territory. So safeguards and precautions, we're looking at, and we're looking at what we can and what we cannot do. And we are also working with the local health unit. We have a provincial association, the Ontario Community Support Association. They send out updates 2 or 3 times a day. They have webinars. So the situation is fluid, but certainly nutrition is one of the things that concerns me the greatest. That particularly people that do not drive and do not have a social, they don't have a safety net, they don't have family support perhaps. So those people, and it's not just the meal, the hot meal every day either. It's someone putting a set of eyes on them, and recognizing if there's an issue. And the volunteers have been trained to. There's a reporting loop so that that information gets back to us, and we can check up on that person if something looks like it's amiss.
So it really is a neighborhood watch.
It is kind of a neighborhood watch with hot food. Yes.
Yeah, with hot food. There you go. Yes. But that eyes on is actually critical, isn't it?
Yes, it is, and. As I said, we have a feedback loop. If someone does not answer the door, we have a protocol we go through, and we stay with it till it's resolved. So we will find out where that person is or why they're not answering their door. And, and there's a number of steps we go through, but it comes down to sometimes the police have to enter their premises to find out, is there something more serious going on?
But that's actually an excellent safety device then.
Yes.
Because and the people receiving the service would be aware that if they don't answer the door, there's an action that's going to happen.
Yeah, some take that more seriously than others.
In other words, you do get occasionally that, oops, I forgot to let you know.
My daughter swung by unexpectedly and we went out for lunch.
Yes.
That's not happening these days, though.
No. But it's good to know that it's the key message is certainly nutrition is important and making sure people continue to take care of themselves to stay healthy. And
we have a large site in Owen Sound that we've consolidated a number of freezers in, and we're receiving orders. We certainly have much more frozen food on hand than we would have at any normal stage. So we are prepared to serve people we have not served in the past, and people who cannot get out and get groceries. We can certainly get some frozen meals to them. So
that if they had a microwave or an oven, or they can. So you do both warm meals?
The warm meals happen on a regular basis, but they're only available in certain communities where a population would support that program.
Gotcha.
So we have 17 hot meal programs across Grey and Bruce.
Wow.
But we do deliver frozen meals anywhere. I mean, we deliver frozen meals to Tobermory, and we deliver them to Red Wing. So it's
oh my goodness.
Yeah, it's that is available. That happens. Typically, it happens on a monthly basis. Right now, as I said, it's a new day. So if someone had missed the ordering date and they were out of food, we would find a way to get some frozen food to them.
Am I hearing you say then that you do have capacity if people need food?
Yes.
So how would they call it? What would they do? How do they?
They would call our main number, and I think it's going to be flashed on the screen, but it is 519-372-2999. 2091.
Right.
The general mailbox is 0. The Meals on Wheels extension is 3. You could push either one of those numbers. You will get a digitized response when you call. We do have a skeleton crew in our office just so that, and it's not just to provide the service we can provide, it's to refer people to where they might get support. So, I mean, we've been looking up phone numbers for other organizations and other supports that people may need during this time.
Yeah.
So a lot of times people need information. People, if they're not used to it, they don't know that many grocery stores do deliver. If you live in certain communities,
Right.
that the pharmacies deliver. So it's providing people with information. And it's it's when our staff calls back, it's a live voice. How are you doing? And
Yes.
it's that reassurance that there are things. It is different, but there are supports available.
You know, I've heard the expression, there's no wrong door.
Yeah.
And what you're really saying is you will help people get the information they need or the contact that they need, even if it's not specifically related to your agency.
Yes.
Yeah.
And on that note, I would say all of the healthcare providers in Grey Bruce, there's a group called the Grey Bruce Integrated Health Coalition, and they've been meeting on a monthly basis for, I would think, at least 20 years.
Yeah.
And that is the hospital CEOs, long-term cares represented, primary care, mental health, community services,
Right.
social services, housing. So anyway, certainly they've become more active. They're meeting twice a week by phone now.
Yeah.
During this crisis, the assistant medical officer of health for Grey and Bruce, Dr. Lee,
Yes.
she facilitates these calls, and it's a real coming together. And I've got to say the group of people leading all of the various healthcare organizations, they are certainly committed to these communities and to supporting each other. There's a spirit of cooperation and willing to share human resources, other resources. Personal protective equipment is something that is in scarce
Yes.
supply.
Yes.
And it's people, as I said, it's a new way of doing business.
Yeah.
And certainly the boundaries of our own, or the silos of our own organizations, those are crumbling pretty quickly these
Yes.
days. People understand that people need help.
Yeah. I'm hearing a thump thump, so I think they're unloading
It is
something.
Armageddon.
Oh no! Oh no! Any other programs we haven't covered at this point?
Okay, we've had housekeeping, friendly visiting, Meals on Wheels, Frozen Meals Day program, overnight transportation. I think that's it.
Okay, so I wanted to ask you a few more questions, and
Certainly.
I know that the producer will give me the heads up when I know we're ready to sign off. But Meals on Wheels, is there a cost for?
Yes,
people?
there is, and we charge. It's different in every community. That sounds funny, but the person receiving the meals pays whatever the food supplier charges in that community. So
Okay.
there is a variance.
All right.
We do have a cap on what we would charge anyone for a meal, regardless of what the food suppliers. So the Rotary clubs have certainly stepped up in the last year around providing some money to where those meals are in excess of a certain dollar figure. The Rotaries have come in and said, like, Meaford Rotary, Port Elgin, Southampton,
Yeah.
and I don't want to leave anyone out. There's a number of faith organizations have donated money to that.
Yeah.
There's a baseball team in Walkerton that's donated faithfully for years called the Dirt Pigs. Some of the legions have
Excellent. Yeah.
have donated. The Owen Sound Legion has donated money to the Meals on Wheels program pretty faithfully over the years. So
And that's how the community is helping your
yes,
agency.
and that's not new. I believe there's been a recognition for a long time that food, access to secure food sources, and affordability of meals is something that a lot of people in Grey Bruce struggle with.
Yeah.
So the philanthropic organizations certainly they recognize that, and they're a great asset in our communities, and probably one that don't get a lot of recognition.
So a person who needed to pay for those meals, and how would they do that? Or family members, could they pay by e-transfer? Because you
That's a
probably
great
don't
question.
want to be handling a lot of
No,
back and
and
forth.
we would do an intake over the telephone,
Yes.
and we would take their information, and they would be invoiced at the end of the month.
All right.
So 5 days into the following month for whatever food they purchased during that month.
Right.
And I mean, sometimes we send it to the person receiving the food. And it's based upon how they it might be an adult child,
Right.
as I said, in the same community, another province or another country.
Yeah.
And we will within a week or two have the ability to pay online through our website. You can pay at your bank electronically currently.
Yeah.
You can pay through your bank. We have a pre-authorized payment where you would sign a form and we can debit your bank account on a monthly basis for the service that you've used.
Excellent.
So there's a lot of ways. Given the demographics of Grey and Bruce, we have people who cash is king, and
Or
they,
check.
and they have a hard time letting go of that.
It is true.
And those people I worry about right now because they are used to getting a ride and walking into a
Yes.
building and paying cash over the desk. And
Yes.
our head office, the doors are now closed. We've got signs saying, please call, or we do not let people into our office. If you don't have to be there, we don't want people there at this time.
No. So it's certainly going to be a bit of a shift for some
Yes.
who are more comfortable with certain ways. How can the community help you?
I think awareness, and I think, who lives next door to you? Who lives down the street?
Mm-hmm.
Are they alone? Have you seen them lately? I think, sort of being a good neighbor.
Yeah.
If you see someone's in distress, there's a number of organizations you can call, and as you said earlier, probably any door right now is going to be the right door, because if they don't do it, they will know who does, or they will find out who does,
Right.
and provide that information. So there are certainly, there's United Way, there's the Alzheimer's Society, there's VON.
Yeah.
Yeah, there's lots of organizations out there. The MPP, Bill Walker's office, I'm sure they're still answering their phones.
Yeah.
They're very well resourced. 211
Yes.
it's huge.
Yeah.
211 would have access to all that information.
Yeah.
You just pick up your phone and dial 211.
Yeah. So if I was living next door to a senior, I kind of have to say I'm one of those, but depends on what age they start at, right? I'm going
Yes.
for young. But if I know Mrs. Smith lives next door to me, and I obviously I'm not going to see her out and about like I normally would, arranging even a specific time to call so that
Yes.
if they would know that someone is calling, but also if there's no response, then being aware, okay, don't wait all day and keep calling back because someone could be in distress.
Yes.
To almost prearrange a time that works.
And even referring them to our organization. And as I said, we really don't have a check-in or a safety check. But as I said, it's a new day, and we're looking at what can we do
Yeah.
given the circumstances. So it's certainly something we would look at. We would look at providing whatever assistance we can, or finding who does it and connecting them that way.
Yeah. So you have a dedicated, obviously, staff and
Yes.
volunteers. You aren't able really to train volunteers at this point in time, I wouldn't think.
That's correct.
Do you need people to assist in manning the phone or doing any other strategies?
Not at this time, Carol.
Yeah.
Because we have a lot of very talented program staff
Yeah.
who are not in program these days.
Right.
So we
So you
have
have the
capacity
availability.
currently. Now, if this goes on as long as we anticipate it may, that may well change, because I
Yeah.
would think as
Yeah.
people are not able to leave their home for
Yeah.
longer periods of time, the need for
You may
some
need-
sort of socialization
Yeah.
is going to become very acute. So
yeah.
we would certainly take people's information,
Yeah.
but we are able to manage with our current resources. But that being said, when
never
things
know.
return to normal, whatever
Yeah.
that may be after this,
Yeah.
we're always looking for volunteers.
Thank you, Andy. And believe it or not, our time is up. I want to thank you very much. And I want to thank you for watching this special edition, COVID-19. Please stay safe, stay healthy, and take care of each other. Thank you, Andy.